Hello, hi. Today I'm going to talk about peritoneal dialysis catheter care, especially focus on swan neck peristernal. The objectives of this presentation, I'm going to focus on what is a swan neck PD catheter and what's the rational advantage. I'm going to choose this PD catheter and what is so. There are several types of catheter available for use. It's a catheter with a different intraperitoneal part. For example, some is a straight, some is a coin, different subcutaneous segments. Some is a bend, some is a straight. The bend like a swan neck. The straight one is just like a turncoat cuff. The number cuff of the catheter can be single, it can be double cuffs. So, in existing literature review, there's no consensus about which type of catheter. This presentation, I'm going to focus on the swan neck peristernal peritoneal dialysis catheter. So, the swan neck peristernal PD catheter is designed to exist on the chest. It composed of two silicone rubber tubes and cut to a proper length and joined with titanium connector and at the end of the implantation. So it has also two downward pointing. So swan neck catheters are made of silicones, so extremely kink resistance. So catheter can be placed at operation room through laparoscopy. A swan neck catheter that has a two dacron cup. There are three portions of the PD catheter. You can see its outer segment, which is connected through adapter to the solution transversion side, and the intramural section. This has a dacron cuff, a space about 8 centimeters apart, but creating an inflammation response fibrous tissue to fix the catheter into position. Therefore, to minimize the leaking of the dialysis and prevent bacteria into the catheter tunnel. And there's third part is intraperitoneal section, which has many small holes up to the side, is suitable inside the peritoneal cavity. So the rationale of the swan neck peristernal PD catheter. So the first one is the swan neck catheter is the second most common catheter used. It has a permanent bend which enable to external and the internal abdominal segments to downward to reduce tension on the catheter. The chest wall has a far less motion than the abdominal, so there's less subcutaneous fat on the chest, facilitating the advantage of the swan neck peristernal pedicaster is there are two downward point segments is preventing accumulation of the sweat and the pus. The exit side location is the chest instead of abdominal, so the chest has minimal wall movement, so decrease the chance of infection and the trauma. Double Dacron cuffs minimize the migration of the bacteria, and the chronic catheter reduce abdominal pain. So those catheters especially is good for the people who has abdominal ostomosis, and sometimes the children, elderly with the diaper, and the obesity patient. So pre-insertion preparation. So a comprehensive assessment should be performed, such as include the patient's lifestyle and work occupation hobbies should take into consideration to encourage the patient to participate in self-care. So discuss the insertion site with the patient. So patient should be in relaxed position, in sitting or supine position, and be the catheter selection. So this really depends on the patient factors. So usually you have to make sure the catheter should be on the belt level above or below, and the patient obesity, over slim or skinny, and avoid the surgical scar. If the patient have a urinary fecal incontinent, so usually we prefer the posternal the pre-operation care. So make sure the patient before the operation have to take a bath and shower. If there's a lot of hair around the abdominal area, should be removed by electric clips. And make sure there's bowel preparation the day before the surgery. Usually we give patient for pack and also nothing by mouth after midnight. So for the skin preparation, we have to do the screening for MRSA and then there's a candidate for steps errors and administration for prophylactic antibiotics 1 hour before the procedure. And also you need to monitor blood work such as iron. So post-operative care. So the goal is the part of the care is to delay the bacterial colonization and to minimize trauma. So the first you have to make sure you have proper hand hygiene, use a step technique for the exercise dressing change. You initially should be disturbed for 7 to 10 days to minimize bacterial colonization, and never use a strong disinfection such as or only use for sterile water and normal saline. The exercise should be dry. For the catheter tubing, you need to be immobilized to prevent the trauma to the exercise. So long-term care after exercise. So for the chronic side care, especially chronic side care, usually start after 2 to 3 weeks after insertion. So you have to make sure practice good good hand washing and keep the exercise clean and dry. Prevent any trauma. Avoid remove any scar if you see around the skin, and avoid use a strong irritated solution to clean the skin. Usually only the sterile water or normal saline. You mobilize the dressing with tape. So there's some picture to show you what is a normal exercise. So the first picture is a normal person. How to care for the exercise. So it should be so look at the side. It should not be red, painful. The color should be so okay. No swollen, no discharge, no pus. If you want to clean it, you should clean with um, gently clean throughout the. So patient teaching strategy. So you encourage a patient to practice self-care, provide emotion support. Sometimes we can introduce them to the support group for the people who have the same condition. They can share their feeling and experience and to provide the verbal writing education material. Thank you for watching.